Hi, you guys. Welcome back for our daily practice questions. It is day 112, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 23-year-old patient calls your office and says she forgot to take her combined oral contraceptive pill on yesterday, but took today's pill this morning as usual. What is the most appropriate response? Is it A, instruct her to stop the pack and restart the next cycle? B, advise her to take the missed pill tonight and continue with the pack as usual? C, tell her to take 2 pills today and skip tomorrow's? Or D, recommend emergency contraception immediately? Take a moment and tell me what you got in the comments, you guys. Make sure y'all comment, and I'm going to start pulling names from the people who comment to give you discount on services because I find that y'all send me messages about your answers, and I'm finding that y'all are nervous to answer here, but answering and getting a response, even if it's incorrect, helps you to retain it. So let's get a little crowd participation. All right, so stem of the question. What is the most appropriate response? All right, so what are we responding to? So we have a 23-year-old patient that called the office, says she forgot to take her birth control pill on yesterday, but today she took her pill this morning as she normally does, right? So what are you going to tell this patient to do? And I always say, imagine that this patient is in the office with you. They're right in front of you when you're reading these scenarios. Oftentimes that'll help you to navigate smoothly like you would naturally do versus missing parts and pieces that are important when you're just trying to read through the fluff, right? So you get this phone call. She's missed her pill on yesterday, but she took today's this morning. So you're going to advise her to take the missed pill tonight because she's already taken today's, right? And then have her to continue her pack as she normally does. So the one that she missed, take it this evening. She's already taken one this morning, and that'll have her caught up. All right, question number 2. A 30-year-old patient forgot to take her pills for 2 consecutive days in week 3 of her pill pack. She asked what to do next. What is the best recommendation? Is it A, skip the missed pills? B, take one missed pill now and another this evening? Take the second missed pill tomorrow morning and then that day's pill that evening and use additional contraceptive measures? Is it C, stop the pack immediately and wait for withdrawal bleeding? Or D, take the 2 missed pills now? Take a moment and tell me what you got in the comments, y'all. All right, and stem of the question here states, what is the best recommendation? So again, what are we recommending? So we have a 30-year-old patient who forgot to take her birth control pills on 2 consecutive days. So what are you telling her to do next? And in this scenario, B is your best answer. You want her to take that missed pill now, as soon as she remembers. Take the one for that day on this evening. Then on tomorrow morning, take the second missed pill. And then that evening, take that pill that's scheduled for that day. And then they'll be back on their usual schedule, okay? But because there's been so much missed consecutive days and altering of the pills, make sure that she is using additional contraceptive measures for at least 7 days. All right, and question number 3. A 35-year-old breastfeeding patient comes to your clinic 6 weeks postpartum. She wants to start birth control but is concerned about the effects on milk supply. She has a history of migraines with an aura and prefers a daily pill method. Which contraceptive option is most appropriate for her? Is it A, a combined oral contraceptive pill? Is it B, a progestin only pill like the mini pill? Is it C, the NuvaRing ring? Or is it D, a transdermal patch? Take a moment and tell me what you got. All right, and stem of the question here, which contraceptive option is most appropriate for her? So still think treatment. So we need to figure out what's going on, right? So we have a 35-year-old breastfeeding patient, comes in 6 weeks postpartum. She wants to start a birth control pill, but she is concerned about her milk supply, right? Remember, with breastfeeding women, we only do progestin only birth control. So B, the mini pill, is what's going to be best for her. And the reason being for this is, like our combined pills that have the estrogen and the progestin, estrogen can reduce the milk supply. So you don't want to give something, especially when that's her concern. You want to make sure that you're giving the progestin only. So the mini pill, if you ever see that name, those are progestin only, okay? All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, one, at gmail.com. Everything that I do offer is linked in the bio of this channel, as well as if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions. I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.